The junior doctors are back out on strike. It is their 11th strike during their dispute with the Tories. This one will last 5 days, and despite them claiming it's not political, they've timed it to coincide with the general election. Still, at least it's not Christmas, when they also went on strike to demand a 35% pay rise. Dr Robert Lawrenson, the British Medical Association junior doctor representative, whose LinkedIn page actually describes him as doctor interested in working and doing the job, said this from the picket line.
Well, it's time for any government, anyone in power, to put down their rhetoric, to get round the table and actually present a credible offer to pay restoration. That doesn't have to be in one go. We can do that over a series of years. We're very happy to discuss a journey.
OK, well, here's some important context. The government and the BMA had agreed to independent arbitration in May, but that was put on hold when the election was called, and the union then called the strike. It has asked for a 35% pay rise to make up for what it says are 15 years of below-inflation pay rises. Junior doctors received a rise averaging nearly 9% in the last financial year. Here's what Tory Health Minister Victoria Atkins said about the strikes last night.
Been in the room with the doctors repeatedly, the Junior Doctors Committee, and they walk out. We know that what they are asking for is unreasonable for the taxpayer. It will cost £3 billion. So again, how is Labour going to fund that if they're going to meet that 35% pay rise that junior doctors are wanting? And what I want to do is, I've throughout said to Junior Doctors Committee, they call off these strikes. If they put patients first rather than their pay, then I will get straight back round the negotiating table with them once the election is over.
And here's what the Labour Party has to say.
To be fair to them, and I'm not happy about the strikes, I think these are unnecessary strikes the next 5 days. We're so close to the general election. I wanted them to wait and give me a chance, if I'm the Health Secretary, to sort this out. But we are where we are. I've said that we can negotiate on pay. They've shown a willingness to move on pay too.
Well, Keir Starmer and Wes Streeting have vowed to meet with junior doctors on day one of a Labour government. Yeah, there we go. On day one. And today, this headline emerged: striking doctors are confident Labour is listening to their pay demands. Well, this comes after both Starmer and Rayner met with union barons of different unions, it must be said, in May, and reportedly reached an agreement with them over workers' rights. What does all of that really mean, then? Doctor strikes cost lives. The last one in February saw 91,000 appointments, procedures and operations cancelled. The question is this, really, isn't it? Do you think a Labour government would stop the strikes, or would they be at the mercy of the unions? Let's get the thoughts of my panel this evening. I am joined by former MEP and the Director of the Centre of Migration and Economic Prosperity, Stephen Wolfe. I also have Tory peer Lord Bailey, and I have got the political journalist and broadcaster Zoe Grunwald. Stephen, I'll start with you. Do you think that Labour would be able to stop the junior doctor strikes?
I think absolutely, because the junior doctor strike has been caused to maximise the embarrassment of the Conservative Party. The whole intention was not really necessarily about money as a whole. It's important for them, but it was really to be part of that whole trade union movement, which was to help bring down the Conservative government. So I would also say that there are about 10 Labour MPs who are former doctors. Maybe, just being the cynic in me, that some of those doctors are looking to their future. OK, all right, interesting. Sean, I can see you're itching to get involved here. I'm just going to... just a couple of facts on this. 1.4 million acute inpatient and outpatient appointments have now been rescheduled since strikes began in December 2022. There's a shout to say they are now responsible for the waiting list.
Listen, this is such a mess, and when the Labour Party talk about who's responsible for the mess, they've got to factor in the junior doctors. It's just a fact. That's what they've been doing. But there's 2 points to be made. One, if Labour magically resolve this after the election, it will look like a very political strike. And why that's a problem, the whole of the NHS is beginning to burn through its goodwill. So currently, when the NHS is in strife, it's the fault of politicians. At some point, I think, in a very near future, the public are actually going to talk to the NHS. This isn't the junior doctors versus the government. It will be junior doctors versus the public at some point. And Wes Streeting needs to be careful, because if he does something outside of the independent pay review body, it could open the door to everybody.
OK, so go on. So do you think, firstly, that these strikes are purely political? We've got days to go before the general election now. Do you think they're killing people, and can Labour sort it out?
No, I don't think they're killing people. I think the underfunding and under-resourcing of the NHS over a decade is killing people. Way before the doctors' strike, way before COVID, there were serious problems with the NHS. We don't have the right number of beds. We've got a lack of capital investment. We've got the lowest real terms increases in the NHS over the past few years, and we've got record-level vacancies. All of these things are what are killing patients. You can talk about the timing of this particular strike. There's been 11 strikes in this particular period, so it's not just like this is their first strike. Clearly, this is an ongoing dispute. They were disappointed that negotiations were cancelled.
Them at the worst times, though, if I may. I mean, Christmas.
Well, strikes are supposed to be inconvenient because
but not
they're
when people. Not when I would argue, not when those strikes involve people living or dying.
But the state of the NHS is causing people to die as well, and that's the point they need to make.
But they are public servants. This isn't just a fight with the government. You know, they are public.
They are public servants, and they take.
I have to say, this idea that NHS is underfunded, it will always be able to spend more money. But you have to be clear. We give it £180 billion. I would be stunned any government finds more money.
Absolutely, and when you've got to factor in also the rise in immigration. The population has risen by 3 million in the past 10 years. So it doesn't matter how much the government is pumping into that. When you start pumping those figures out, you're not making into an effect a calculation of the rise in population and ill health coming from others. You're just simply using it as a flat number. That's inaccurate economics and analysis.
OK, Zoe.
I think the point is that if we have a health service which is beloved by the population, we have to fund it properly and we have to look after it. And you're right, it's not just a matter of pumping money in, it's also a matter of reforms where necessary. It's a matter of making sure that there is enough staff. At the minute, staff are hemorrhaging because there aren't enough of them. They're overworked, they're underpaid, and it's absolutely vital. We've got an ageing population. And, I take your point on immigration. Actually, the NHS is incredibly dependent on immigration. We have a lot of NHS workers from overseas, and they're incredibly important. And I think we really need to respect our doctors and understand not only the sacrifice they made during COVID, but how hard they've worked to catch up for the Tories' failures.
And they do work hard, but they're also paid for that, and they get very good pensions. And when we talk about the NHS and immigration, there's two things. We shouldn't be quite so proud of robbing poorer nations around the world of their best doctors and nurses. We shouldn't be so proud about that. And we also should look at the fact is there's 300,000 plus vacancies in NHS, but apparently that's how many people we imported to work in the NHS. So where are those people and their families? Something is seriously wrong. I fully agree with you that the NHS needs reform and has needed reform for a long time, but I really do think we're approaching a point where it's no longer just the fault of parliamentarians. It will be the people who run the NHS who will have to answer to the public.
I actually, for what it's worth, I did interview Dr. Robert Lawrenson, I think outside that same hospital during the last round of strikes, and I did put it to him, if you got the pay rise that you're after now, would you still potentially go and leave and work in somewhere like Canada or the US or Australia? And he didn't rule it out. So I am not convinced it is all about money.
It's not all about money.
I think it's political.
Conditions as well.
No,
it's not.
I'm sorry. I really do think now that there is a large chunk of this that is overtly political.
But it's also about conditions. If you have not enough staff, not enough beds, you have problems with social care. That means older patients are trapped in beds. They can't go back into the communities. Basically, the NHS is falling apart at the seams. This is, in some ways, it is a political strike. And the reason it's a political strike is because it's protesting the Conservative government's policy choices.
I'm sorry. The reason it is, I do accept there is a political strike. There's some, but my point is, right, if this NHS is struggling, what are they spending our money on? Why do we have diversity officers? And that's coming from a guy who's black. Why are we spending hundreds of thousands of pounds on those sort of things and not spending it on frontline services? At some point, somebody in the NHS has to stop blaming it on politicians and do their job.
And you look at the costs that are being spent across the board. It's not just DEI. It's about the PR that's used. What about all the adverts that are being placed around hospitals? And this is the point where you start looking at who's managing and running the hospital trusts themselves. I've met several of them, decent, lovely people. But at the end of the day, are they really effectively running those hospitals? No. Then we've got to look at the analysis of the costs of medicine. How are we dealing with the pharmaceutical companies who seem to have a control over many parts of the budget? It isn't just about the government alone. It is simply also about the people running it and managing it. And your point about them leaving is very accurate. They will still leave because they can make much more money in America.
Well, and have a
than
better
they can do here.
lifestyle a lot of the time.
But
It's very difficult for us to compete with Bondi Beach.
No, but we could address that.
It is.
The way in which we pay all of our civil servants is there's a movement now, a conversation to say a lot of the value of our civil servants is locked in their pensions. Maybe we could look at paying them more, so more upfront, more in their salaries and less in their pension. So same overall cost, but greater benefit to them earlier.
OK, so let's just to round off this chat then, do we think, I'll go down the line on this, do we think there will be more or less strikes in the NHS under Labour?
I think there will be less initially, but when Labour is unable to achieve what they want, they might come back towards the end. Okay.
That's correct. Sadiq Khan promised no strikes when he became Mayor of London because it was his union friends. It now turns out that he has a record level of strikes because he couldn't satisfy them, and Keir Starmer will not be able to satisfy junior doctors.
So what do you think?
I think there'll be less strikes because I think Labour's are genuinely in a better position to make a deal with junior doctors, and I think they care about the NHS.
And you think that really that is going to... We're probably going to get somewhere near the 35% figures under Labour?
I don't know what the percentage will be, but it's not just about pay, it's also about conditions.
That's how they'll fudge it. That is how they will fudge it. Let's be clear. Those doctors said if they don't get 35 pence, the government can stroll on 35%. If Labour don't offer that, it's been political and it's a fudge.